Dr. Calvin Soon is on the front lines of this pandemic. You have been documenting all of your days. Where are you today? How are you doing?
Uh, Still alive. That's what counts. I am everywhere in New York City and nowhere at the same time. I am per diem, so I work at the majority, if not all, the hospital systems in New York at this point, and I choose whenever and wherever I want to work. So it could be 5 minutes from now, I might get called in for a shift, and it's up to me to decide whether to go in or give myself a day off.
How would you describe what you're seeing at this point?
I think we're seeing a bounce, if not a second wave, come this week. And this is relative to the last 2 weeks where things were decompressing in the emergency room. People are still dying at high rates, but those are the people that have been admitted to the hospital for about 2 to 3 weeks now. It takes usually that long for you to start having symptoms to go into cardiac arrest and then be pronounced dead. And people are still being discharged, but I think the rate of death is much more pertinent to this virus and what we're seeing. And in the emergency room, more non-COVID-19 people and complaints are coming in because they waited so long to hold out and they can wait any longer, or people start having cabin fever, or the weather is getting better, a combination of all those things. Can't really make a generalization when it comes to New York City. Everyone has their own reasons. And our job is to simply treat them when they come and clean up the mess or put out the fires if there happens to be another surge, which we do expect. Because once you come to the emergency room, you're likely to have caught COVID-19 simply by just coming. And then so we do expect a lot of these patients to come back 2 to 3 weeks from now.
Tell me what like a normal day is in terms of putting the gear on, taking the gear off, grabbing a bite to eat. How does that go?
It depends on the hospital. Some hospitals have more room, some hospitals have no room. And most of the time I eat outside, even when it's cold. Well, thankfully, I have a bunny suit to keep me a little warm, and I wear ski jackets underneath. And then I eat outside because I'd rather be outside than a small 10 foot by 3 foot or whatever, 4 foot by 8 feet break room where people have to take off their masks to eat. And it's an enclosed area with no airflow, no negative pressure. So if somebody happens to be an asymptomatic carrier of the virus before they have symptoms, they could be spreading it in a small room. So for me, I like something where I'm in a space where the breeze can, push the virus away, especially if it's aerosolizable. And we know that the virus can live in the air for 3 hours. So that's been, my daily routine. And then also putting up PPE. Originally, it was doing it in the break room because I was worried that doing it before getting into my, Uber or Lyft drive, the driver would just, get scared and drive off and would never make it to work. So I would put on the stuff in the break room after walking through a full emergency room of patients with COVID-19. But now I do it before getting to the car because I think it's our new normal, and no one has declined a request to pick me up. So I do that before, and I take off the stuff before I get into the car after a shift.
Can you address the demographics of the patients that you're seeing? We know that we're talking about a disproportionate segment of the population that's coming to the emergency room. Can you talk about that?
Yeah, everyone can get affected by the virus, but not everyone has equal access to healthcare. This was a problem before COVID-19. I mean, I don't know why people are like, oh my God, the healthcare access has been unequal. Why did it take you this long to realize that that was already a problem? Way, 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 way before a pandemic came around. The problem hasn't changed. It's the context that has exacerbated an already existing problem. If you look at all the infection areas, those are usually in neighborhoods that have a lower socioeconomic status or averages, lower access to healthcare, closer to power plants that increases rates of asthma. And because of the socioeconomic averages are much lower, you can expect a family of 10 to be living in a 1 to 2 bedroom apartment where they all share 1 or 2 bathrooms, as opposed to the lower infection rates happen to be in the parts of the city where socioeconomic averages are higher, where people do have space to have 1 bathroom per person, where you have 2 people living in a 2 bedroom apartment, or they have the monies or means for access to a car or a vehicle to leave the city and live in their summer homes or in their 2-floor apartments or 2-floor houses where you can enact social distancing and self-quarantine comfortably. You can't expect that in outer boroughs where so many patients, when you tell them to self-quarantine and one person happens to get it in a family of 10, then the whole family gets, infected, and there's really not their fault. It's just the status of, the way things have been, and the unequal access to healthcare that we've all been observing. The hospitals itself in outer boroughs are all fuller than the hospitals in Manhattan.
When we see those images of Elmhurst, especially in the initial days, that's the real epicenter.
Anything that's not Manhattan, Midtown or downtown Manhattan, is an epicenter. And it includes Queens, and in Brooklyn, and the South Bronx, and Staten Island. It's everywhere, and uptown Manhattan.
There has been a talk about a lot of women in leadership, and is there any effect of gender that you're seeing, or anything that you could talk to regarding women in leadership during this time?
Well, all the women leaders happen to be doing a great job around the world. I noticed that, especially the Prime Minister in New Zealand. But within the United States, we do see more. If you really look through the gender lens, the only thing I've noticed is that more men die from COVID-19. More men get affected. It's about 60% to 40%, just by statistics alone. First
of all, how are you keeping yourself healthy?
Like physically or mentally? It's
both.
Yeah, they're both equal but different. Physically, every day I do push-ups. I'm trying to get as many one-arm push-ups in during when I'm, in quarantine and I'm not working. And I do eat healthy. I try to get at least 8 to 9 hours of sleep every night now, or at least 8 to 9 hours every 24 hours if I do late nights. And I maintain a balance. I don't want to be doing Monday morning quarterbacking here, but what do you think the biggest mistakes have been so far? We've been through this before. We are a country that eradicated polio and smallpox, or a world that eradicated polio and smallpox. And yet we still debate whether people should get immunized for the measles or or the flu. And I get it. Like, the vaccine argument is, there's a constant internal debate. That's what is the ingenuity of American pendulum, the pendulum that swings back and forth, where your rights, to be able to vote, whether a person of color or as a woman or disabled or religion or whatever it is, always in response to challenging an already existing law that was wrong, or was wrong at the time. And it's this struggle for progress defines what we are as proud Americans. So as a proud American and a born and raised New Yorker, anything that you tell me to do, I will question. That's the way I was raised. That's all I know. But at the same time, there is that delicate balance between public health and personal freedoms. And while I still maintain that you can do whatever you want, I am not one to tell you what to do, especially in my position. You have to accept the consequences of your actions. So when it comes to preparing for this, human beings have been notoriously horrible at predicting anything. Otherwise, we wouldn't have gotten this mess in the first place. But the least we could have done was to remember and recall that we've been through this before, the 1918 Spanish flu, H1N1. And yet we still say we want the personal freedom to decide what we want to do in the moment. And that's where we are now, where we have to accept the consequences of the actions of the collective, of a whole, of all of us. But what we can do right now is to further minimize that risk, right? Prepare to fail to prepare, prepare to fail. I signed up for this, where I will put out the fires and clean up that mess no matter what. But if you want to make my life easier right now, what we can change is preparing for the future, where you can make a decision that's different from the ones that you made in the past, to prevent further unnecessary death, to make my life easier, so that I don't have to keep coming in, putting out fires, getting myself sick, to the point that my staff will start getting sick, to the point that all of us start getting sick, that nobody will be around to take care of you when it's your turn to get sick. What are the decisions? How can we help you? Hashtag I don't know if you can curse on this. Hashtag stay the home. Stay home. Like, if somebody watching this right now, if we can convince just one of you to just hold off on coming to the emergency room unnecessarily, just for one more day. Maybe you don't need that work note. Maybe you don't need that med refill. Maybe you can do telemedicine if you have access to a working Wi-Fi connection. Maybe you can convince a family member not to go out. You will have saved countless lives, because let's say somebody with COVID-19 sneezes in your hallway 5 minutes prior without caring to clean themselves up or clean up, whatever, and they walk away. We know the virus, once it's aerosolized, can live in the air up to 3 hours. That's just a chance. Then you decide to leave the apartment for your breath of fresh air, which is important. But let's say you take that risk and you inhale that virus in, and then it starts incubating, and then you start spreading it to all the people in the grocery store when you go, next, or you bring it back home to your family, and then you give it to grandma, and then they spread to other people, and they spread to more people. All those people come to the emergency room, and grandma will be on life support because of your risk that you took. I'm not trying to make people feel bad, but just know that every action you take in a time like a pandemic carries potential harm and risk, and you can change a lot of outcomes simply by not doing something as well.
Well, Dr. Soon, thank you for everything that you're doing. You've been amazing, and I'm staying home. I hope our audience will be staying home, and I wish you from the bottom of my heart all the very best. Thank you so much for joining us today.
Thank you for having me.